Good morning, world. Happy Mental Health Awareness Month. Today we're going to talk a little bit more about depression. It's a word that gets thrown around so much, and like a lot of mental illnesses where we use them more as adjectives and they become so diluted, and people don't really get to understand these illnesses because we just throw them around like we use the. So today we're talking about depression. I remember this summer, one day I just looked so overwhelmed. I was just tired and having one of those days where I was tired. And my goddaughter looked at me and she says, "What's wrong? You look depressed." I didn't look depressed. I look tired. But that's kind of how our society uses mental illness. Someone does something and they say, "Hey, you're bipolar because you did this," but really have no understanding of what bipolar means. Just like my goddaughter had no idea what depression really meant, but I looked upset that day. Probably I was tired, so she said I look depressed. So today we're talking about depression. One of the ways when I first started learning about depression, it was described to me as anger inwards. Whereas something is happening, and instead of taking it out on the world around us, we take it out on ourselves. And it's not necessarily that you are saying that it's your fault or or you're blaming yourself. It's just that whatever emotions that you're experiencing, you're keeping them inward, and instead of being out in the world terrorizing other people, they're inside you terrorizing you. So depression, again, sometimes is defined as anger inwards. And what it is that feeling, it's a feeling of, could be sadness or lack of interest in the things that normally would have excited you. And it's not something that you experience just one day and it's called depression. In order for it to qualify, it has to go on for a prolonged period of time, usually at least a good 2 weeks or so. And in addition to having either that extreme sadness or loss of interest, there's about 7 other symptoms that are required in order for someone to be able to qualify for a clinical diagnosis of depression. And of those 7 that you would need to have at least 5 of them, again, for that extended period of about at least 2 weeks. Things like difficulty sleeping or sleeping too much, difficulty eating too much, or losing or gaining weight very rapidly, difficulty concentrating, or things like person moving too fast, like noticeably too fast or noticeably slower because they're fidgety, or because they're just don't have the energy. Again, lack of energy is a major symptom that a lot of people with depression can experience. And they have issues such as negative thoughts about themselves or their situations that will happen. And all of those combinations put together over a long period can classify for a diagnosis of depression. A couple things to know about it is major depression, for example, or let me step back. Depression has absolutely no demographics. It can affect everyone at any time. It usually has an onset, meaning that an incident that happened that initiated that first symptom to start happening. But because depression is such a an opportunistic disease, it capitalizes on any little opportunity that it gets. So because depression is so opportunistic, when something happens that starts the feeling, what generally happens is that if you don't address it right then and there, if you don't take action to fight the symptoms, to remove the symptoms, then they continue to grow, they continue to develop, and over time it grows into depression. Again, usually a diagnosis of depression would require at least something like that going on for at least 2 weeks, but some people battle depression on and off for several years, for most of their adult lives or since they were kids, but it happens. The one thing we need to know is that it's not, there are things we can do about it. It can be helped. It's just a matter of each individual and the people around them realizing that, hey, something's going on and it's time for us to do something, and getting together and doing something about it. In my next clip, I will talk about some of the things that you can do as an individual who either is experiencing depression or someone who knows a person in their lives is experiencing symptoms that look like it may be depression, the things that you can do about it. But before I go, the few things I want you to remember about depression is that, one, it has absolutely no demographic. It can happen to anybody, and that's why we're all technically at risk and therefore need to be more vigilant about it. And two, just because there's a history in the family, that does increase the likelihood or propensity that someone that you may also be susceptible, or that's what I was looking for, susceptibility. Having the history in your immediate family increases that susceptibility, but that doesn't mean that you're going to get it too. It just means that you need to be aware that, hey, you know what, there is a history of this in my family, just like you would do for any other illnesses, and making sure that you're taking the right precautions. Like, if you know that there's a history of breast cancer in your family, you don't just sit back and wait until, you know, your breast is unbearable to go to the doctor. You start paying attention to little symptoms and you get them addressed. And that's the same thing that you need to do with depression. When you know that your mom or your mom's sister had battled major depression most of her life, and you start noticing, okay, I'm noticing symptoms here in myself, or I'm noticing symptoms in my daughter, what you need to do is be proactive about it. Get up, start doing the things that you know you need to do to begin addressing it, whether you're addressing it personally, and if that doesn't work and you need to go on and get the help of a professional, do that. Don't wait, don't sit around. Depression is very, very opportunistic. So if you give it a chance, it will grow. So don't wait with it, don't sit with it, don't play with it, get it taken care of. And again, most important thing is that I want people to know is that depression is not the end. It can happen, it will happen, it does happen. But the one thing that we can always be assured of is that there's help. You can help yourself, you can get the help of a professional. So whatever it is that you're going to choose to do, just make sure you do something, right? And stop calling people depressed just because they look sad for one day, okay? All right, that's all I have for today. Good morning, world.